So, hello and welcome back to the podcast. I hope that everybody is doing good. Welcome back to what is season 13 of the podcast. I can't quite believe that the podcast is 6 years old soon. I started it back in 2020 and that just seems crazy to me. It was during COVID. Season 13, and I'm really excited to still be here and still be talking to you guys and have so many people who listen and then who continue to listen when their babies are born or who come back and find the podcast again for sort of subsequent babies. So that's really lovely for me. Today, we're talking about something that comes up so often towards the end of pregnancy and something that can really shift how you feel in those final weeks, and that is baby size. You might find yourself hearing phrases like your baby is measuring big or your baby is on the smaller side. And suddenly, what felt like straightforward pregnancy can start to feel a little bit more uncertain. And then what usually follows is conversations about induction, additional monitoring, or even caesarean birth can come into the picture sometimes quite quickly. So today, I want to slow it down, all of this sort of noise around baby size, and bring you back to the evidence, the context, and most importantly, your options. So I'm going to talk about what we actually mean by big and small babies, how accurate scans really are, and how predictions about size can influence decisions at the end of pregnancy. As always, this episode is not about telling you what to do. It is about helping you understand what is behind the recommendations so you can make decisions that feel right for you. So let's start with the language, because this is often where the confusion begins. So when your hospital, your obstetrician, your midwife, your care provider talks about a big baby, they are usually referring to what is called macrosomia. This is typically defined as a baby who is estimated to weigh over 4 kilograms, or sometimes over 4.5 kilograms, depending on the guideline that's being used. When we talk about a small baby, you might hear the term small for gestational age, or SGA. This usually refers to a baby whose estimated weight is below the 10th percentile for their gestational age. There is also another term, fetal growth restriction, or FGR, which is different from simply being small. So FGR refers to a baby who is not growing as expected due to an underlying issue, often related to the placenta. And this distinction really matters because a baby who is constitutionally small, meaning naturally small but healthy, is very different from a baby who is not growing well. The same applies at the other end of the spectrum. A larger baby is not automatically a problematic baby. Many babies are simply genetically larger, just as some are smaller. So, how do we even estimate baby size? So, in the UK, this is usually done through a combination of fundal height measurements, which is when your midwife measures your bump with a tape measure, and then also ultrasound scans. Ultrasound estimates are based on a series of measurements, including the baby's head, abdomen, and femur length. These measurements are then put into a formula to estimate the weight. And this is where we need to talk about accuracy. Ultrasound scans are not precise when it comes to predicting baby weight. They are estimates and they come with a margin of error. Most evidence suggests that this margin of error is around plus or minus 10%, and in some cases it can be even wider. What that means in real terms and real figures is that if a scan estimates your baby to weigh 4 kilograms, which is £8.13, the actual weight could reasonably be anywhere between 3.6 kilograms, which is £7.15, and 4.4 kilograms, which is £9.11, and sometimes beyond that range. So I'll just say that again, because obviously all the numbers can feel like you can't make sense of them. And I'll do it just in pounds and ounces. If your scan estimates your baby to weigh £8.13, with their margin of error, which they accept there is a margin of error, the actual weight could reasonably be anywhere between £7.15 and £9.11. So you can see that is a huge difference. That's almost one entire pound difference either way that the baby could be. And that is their accepted margin of error. And the same applies obviously for smaller babies. A baby estimated to be small may actually fall within a normal weight range at birth. Research has shown that scans can both overestimate and underestimate size. And in fact, it is not uncommon for babies predicted to be large to be born at an average weight, and for babies predicted to be small to be born completely healthy and within a normal range. And this is important because these estimates often form the basis for significant decisions. So let's talk about big babies first, because this is an area where intervention is commonly discussed. If your baby is estimated to be large, you may be told there is an increased risk of complications such as shoulder dystocia, where the baby's shoulder becomes stuck behind the pubic bone during birth. It's really important to understand both the risk factors and the actual numbers here, because this is often where fear can escalate quite quickly. Shoulder dystocia occurs in around 0.5 to 1% of all vaginal births, so it is relatively uncommon overall. The risk does increase with higher birth weights. So for babies over 4 kilograms, the risk is estimated to be around 1 to 2%. And for babies over 4.5 kilograms, it may rise somewhere between 5 to 9%. However, what's often not talked about as much is that most cases of shoulder dystocia actually occur in babies who are not classified as large. And this is because the majority of babies are born within an average weight range. There is also other factors that can increase the likelihood, including gestational diabetes, a previous shoulder dystocia, assisted birth using forceps or ventouse, and a long or very fast second stage of labour. And even with all these risk factors, shoulder dystocia is still very difficult to predict or prevent with certainty. In most cases, when it does happen, it is managed effectively by trained professionals using specific techniques to help the baby be born safely. So while this is a real and important consideration, it is also important to hold it in context. The absolute risk remains low, and decisions are often being made based on estimated weights that, as we've discussed, can be significantly inaccurate. You may also be offered induction of labour or a planned caesarean based on estimated size. In the UK, guidance suggests that induction for suspected large babies may be considered, particularly if there are additional factors such as gestational diabetes. However, the evidence is not clear-cut. Some studies suggest that induction may reduce the risk of shoulder dystocia, but it can also increase the likelihood of other interventions, including assisted birth and caesarean as well. There is also no strong evidence that induction significantly reduces the risk of serious harm. Planned caesarean may be discussed if the estimated weight is very high, often above 4.5 kilograms, particularly if there are additional risk factors. However, again, this is based on estimated weight, not a known weight. So what we have here is a situation where decisions are sometimes being made based on a prediction that has a significant margin of error. Now let's look at the other side, at small babies. If your baby is measuring small, you may be offered additional scans to monitor growth, as well as Doppler studies to assess blood flow through the placenta. If there are concerns about fetal growth restriction, close monitoring is important because in these cases there can be increased risks, including stillbirth. However, many babies who are labelled as small are simply constitutionally small and are perfectly healthy. One of the challenges is that it can be difficult to distinguish between a baby who is small but healthy and a baby who is not growing optimally. Because of this uncertainty, you may be offered induction, often before your due date, particularly if growth appears to slow or plateau. I personally have mixed feelings about inducing a small baby, particularly if there are concerns that the baby is small because of growth issues and because of placenta. I feel like induction is such a harsh process on the body and on the baby that if the baby's already struggling, then induction just feels very counterintuitive to me. But that is just very much a personal opinion on it. And it's definitely worth doing your own research into induction for small babies. It's all individual, and this is why informed decision making is so important. If your baby is measuring on the smaller side without other concerns, it's very much worth having a deeper conversation about the risks and benefits of early birth versus continuing the pregnancy with monitoring. So now let's take a step back and talk about these predictions and how they can influence the end of pregnancy. Being told your baby is big or small can shift the tone of care quite quickly. You might find that your pregnancy is suddenly framed as higher risk, even if everything else is normal. And this can lead to more appointments, more monitoring, and more recommendations for intervention. It can also affect how you feel. You might start to doubt your body, feel anxious about birth, or worry that something is wrong. This is why understanding the limitations of these predictions is so important. A scan is a tool, it provides information, but it does not provide certainty. And when decisions are being made, it's important to weigh not just the potential risks of your baby's size, but also the risks and benefits of the interventions being offered. For example, induction of labour can be helpful and appropriate in some situations, but it can also come with its own considerations. It can lead to longer labours, increased need for pain relief, and a higher likelihood of further intervention or caesarean section as well. Caesarean birth is a major abdominal surgery with its own risks and recovery. And so the question becomes not just what is the risk of a big or small baby, but also what are the risks and benefits of the options being offered to me. This is where your voice and your preferences really matter. You might want to ask questions like how accurate the estimate is in your specific case, whether there are any concerns beyond size, what the absolute risks are, and what the alternatives might be. You might also ask what would happen if you chose to wait and how you and your baby would be monitored. For some people, having more intervention feels reassuring, but for others, avoiding unnecessary intervention feels more aligned with their values. There's no one right answer here, and there's only what feels right for you based on the information available. I also want to gently bring in an important perspective as well. Your body and your baby are not working in isolation. There is a relationship between your body and your baby's size. Often your body grows a baby that it can birth. That doesn't mean that complications never happen, but it does mean that size alone is not a reliable predictor of how birth will unfold. We also know that position, movement, and the environment you give birth in can all influence how smoothly birth progresses, sometimes more so than size itself. So if you've been told your baby is big or small, it's okay to pause, it's okay to ask questions, it's okay to take time to process the information, and it's okay to remember that these are estimates, not certainties. As you approach the end of your pregnancy, you deserve care that is personalised, respectful, and based on a full understanding of the evidence. You deserve to feel informed, not frightened, and you deserve to make decisions that feel right in your body and in your circumstances. So if you take one thing away from this episode, let it be this: a prediction about your baby's size is just that, a prediction. It is one piece of information, not the whole picture. And you are allowed to look at that information in context, weigh it alongside your own values, and choose the path that feels right for you. If this episode has helped you feel a little more grounded or a little more informed, then that is exactly what it was here for. And if you know someone who's been told they're having a big baby or a small baby and is feeling unsure about what that means, feel free to share this with them. Thank you so much for listening. If you are enjoying the podcast, please don't forget to subscribe, rate and review and share with somebody that you feel might benefit. And also don't forget that you can check out my hypnobirthing courses and also my doula support options in the show notes as well. Thank you so much, and I'll see you in the next episode.